All right, everyone, welcome back into Mid-Morning. Dr. Keith Watson is joining me in studio. And Dr. Watson, I was telling you, today I kind of wanted to talk about a different topic of tonsils and ear tubes.
Tonsils and ears.
Very, very different. But, you know, like, I feel like as a child, this is like one of the first few maybe surgeries a child may end up going through. You know, I had tonsil and ear tube problems, so.
I didn't have the tubes. I had ear infections. I never had tubes, but I had tonsils taken out.
So you get the pain right there. So first I want to know, you know, doctor, what do tonsils actually do?
So tonsils, oh wow. So the people at home are going to get a science lesson today. So your tonsils are lymphoid tissue.
Okay.
So they are part of your immune system. Think of them kind of like lymph nodes.
Okay.
Whether they serve a real purpose or not is something people discuss and debate about.
Okay.
Because if you take them out, you really don't miss them, so to speak.
Yes.
So, but they are officially part of your immune system.
And so what would you say, at what point do symptoms of a sore throat or strep become a sign that you may need to get your tonsils taken out?
Typically, if you recurrently have them.
Okay.
That was the reason I had them out. And of course, I hate to say this, I'm old enough that when I was a kid, I don't remember them calling it strep throat. I just remember that I always had throat infections.
Okay.
And I had to have antibiotics for it, and it was just a recurrent thing over and over. And eventually my doctor said, hey, these need to come out, and they took those out. Now, taking tonsils out does not mean you will never get strep throat again.
Yes,
you still can get strep throat, because in my profession, I still catch it from time to time. But you just don't get it as often. There seems to be a state at which maybe the tonsils predispose you to these recurrent infections, and so removing them can help that. So recurrent infections, typically strep throat. If the tonsils are enlarged, really big, and they affect your breathing, children can have difficulties breathing at night and snoring because these things get so big.
Interesting, okay.
I've even had kids in my clinic who have difficulty swallowing food.
Yes.
So if they are causing some kind of an obstruction, whether it be with breathing, eating, whatever, sometimes they're removed as well.
Okay, what about tonsil stones? Is this, I don't know if that's the medical term, but I used to have those growing up, and they were like very disgusting.
Yeah, tonsil stones. They are not something that are in and of themselves necessarily abnormal. Some people have them. Yeah, they're not fun to have, and they don't look the greatest when someone looks in your throat. But they don't typically cause significant problems.
Okay. And typically, I guess if there is a typical age, what is the age, if you are having these issues, that you would maybe get your tonsils out? Do you need to wait till they're a little older in childhood?
So I'll answer this way. I don't know if there is an official age limit, but I do know that most of the time when I have kids who are having issues where I think maybe their tonsils need to be looked at, most of the time ear, nose, and throat physicians will not discuss a surgery about removing tonsils prior to the age of 3.
Okay.
Now, I don't know the reason for that, and I'm sure there is one. I'm just not an ENT, so I don't know this. But the age of 3 seems to be the earliest that discussion can take place.
Okay.
Now, ear tubes are a different story, but with tonsils, it seems to be around the age of 3.
All right, Dr. Watson, guys, we're going to talk about ear tubes when we come back. Stay with us. All right, welcome back, everyone. So, Dr. Watson, we were talking about tonsils before we went to the break, and now we're going to talk about something I feel like you said you see a lot in your clinic, ear infections.
Ear infections and ear tubes.
And so at what point do you recommend a child to get ear tubes? And exactly, what are ear tubes? Like, I've actually never seen these things.
So they are, wow, let me give you an analogy.
Okay.
If you've ever been driving down the road and you see the ditch on the side of the road that water runs through, but you have someone's driveway over the top. So, and you see the little tin drainage pipe.
Yes.
Okay, that's an ear tube.
Okay.
Water is stuck between the two driveways and can't go anywhere, but if you have the little tube, water runs through. So an ear tube goes into your eardrum.
Okay.
And it allows fluid and debris in the inner part of your ear to drain through your eardrum into the outer part of your ear and outside.
That is interesting. I just feel like standing up, like how is that draining? You know what I'm saying?
Because your ear tube is not perfectly flat in your head.
Okay,
It's
okay.
angled slightly.
Gotcha.
So fluid drains out.
So, how long would this type of surgery take? Is it considered a surgery?
It's considered surgery because you're put to sleep. I really don't know how long it takes to do it because I don't do them. Obviously, an ENT does them. But it seems to be a fairly simple, quick procedure. It's other than being put to sleep, there doesn't seem to be, I know I'm going to make my ENT friends mad when I say, oh, there's nothing to it. But it seems to be a quick procedure.
And you said whenever you have some of your patients come in who have had ear tubes, you can see them during the process of examining them, correct?
Sure, if I look in their ear and at their eardrum, I can see the little tube in their eardrum.
Now, at what point does maybe a parent need to talk with you about maybe taking that step to, hey, you know, the ear infections don't seem to get better. What do we need to do next?
Same type of thing. It's a recurrent issue, like with the strep throat. Children that have recurrent ear infections, just one right after the other, typically, I may get this a little bit wrong, but somewhere in the neighborhood of around 4 or 6 ear infections in a year.
My ear hurts thinking about that.
I mean, so basically every other month there's an ear infection. Tubes is probably necessary. Even if you don't have ear infections, if you are someone with a lot of allergy and sinus problems and you constantly have fluid in your middle ear, that can affect your hearing. And a young child, they learn to speak through hearing. So if you have a young child who's not hearing properly, then their speech can be delayed.
Oh, wow.
And so a young child with speech delay, whose cause is chronic ear problems, they may put tubes in. I've seen 6 and 9-month-old infants with tubes.
Wow.
Because if you have all these recurrent ear infections, you can't hear, you don't learn to speak.
That is interesting. So is an ear infection just liquid in the eardrum, or what exactly is considered an infection?
It is fluid inside the eardrum, but it's infected. So it's basically pus inside your middle ear with bacteria growing, so there's pain and pressure and fever.
Now, I guess, you know, I think of cleaning the ears. Whenever you do have a child, how exactly do you clean an ear maybe before you know that they have an infection?
I clean their ear. I have a special tool to remove the wax so I can see the eardrum. I advise parents don't ever attempt to clean your child's ear.
So if they need to, they call you, get the special tool, and get all that done.
Because a Q-tip just packs it down back in there, and you cause more of an issue. And you don't want to put anything else in your child's ear because you don't want to go too deep and rupture their eardrum, because then that becomes a problem.
Yes. Well, Dr. Watson, this is all great information. So guys, if your kids are having problems with getting a reoccurring ear infection or getting a sore throat, talk to Dr. Watson, located in West Point. He'll get his special tools out, help you guys right there. Dr. Watson, it's always great having you in studio.
Thanks for having me.
We'll be right back.